And tonight, we are clearing up some questions you may have about the measles. I sat down with Dr. Sapna Singh with Texas Children's Hospital to get some answers. As you know, here in Austin, we've just seen our first recent case of the measles. Can you talk to me about what someone should do if they think they've been exposed or they feel sick?
So if somebody feels like they've been exposed to the measles or that they're getting some symptoms that may be consistent with the infection, most important thing to do is to contact your physician. For most of us who are fully vaccinated, the measles infection is prevented quite effectively by the vaccine. And so I try to ease some of the anxiety by letting people know that, some of us are going back to kind of the pandemic anxiety and panic, but this is a little different because if you have the two MMR vaccines or the two measles vaccines, you have 97% immunity. So you're quite safe. And even if you were for some reason to develop an infection, it would be rather mild. And the likelihood of you spreading it would also be far less of an issue. Someone who's unvaccinated and has been exposed absolutely needs to contact their physician right away. And then your physician can talk you through what the next best steps would be.
So I know a lot of us, most or some people got the vaccine when they were younger. Is there a certain age group that should be concerned or need to get another dose of the vaccine?
Certainly, if you were born before 1957, there is absolutely an understanding, and the CDC states this as well in their guidelines, that you were likely infected or exposed, and so you should have immunity to measles. Some of the folks that were born in the 1960s potentially may need an additional dose because the vaccine at that time was not the current live attenuated version, and so your immunity may wane over time. And I tell everybody, if there's any question in your mind as to whether you're fully vaccinated or you have immunity, speaking with your physician is very helpful because there are blood tests that can be done to check whether your immune system is still responding to a vaccine or previous infection. And that would help you then decide with the guidance of your physician as to whether or not you needed additional vaccination.
What is the hospital protocol when someone calls and says, look, I'm sick and I think I may have the measles?
Well, the hospital protocol, when you're talking about somebody calling in with a suspected case of measles and the symptoms that would be potentially suspicious, is going to be mostly involved in making sure that we get good care of that patient while also limiting exposure to other vulnerable populations. You can imagine an emergency room is filled with everyone from newborn babies to children who may have immune system issues, healthy individuals and some individuals who may not be able to be vaccinated either due to age or other underlying conditions. And so most of the hospitals and we in our pediatric primary care clinics have protocols and algorithms that will guide the patient to get care with their provider, but also do it in a way that would help to limit the exposure that could happen if they arrived unannounced and potentially did have measles infection that they were able to spread to others.